Well, hello, everybody in internet land. It's Hugh Flax from Atlanta, Georgia, home of the world champion Atlanta Braves. And I'm here with you tonight to share why designing smiles can be fun. And they should be fun. I mean, there's so much BS that we got to deal with in the world. If you go to work, you might as well have fun while you're doing it. And I've been lucky enough to be designing smiles and having fun at the same time since the early 80s. So I used to be the young guy in my class. Now I'm the old guy, but it's cool. I'm having fun while I'm doing it. So let's go ahead and we'll move forward. And, this picture here is a picture of me in the front, my brother next to me, and that young lady in that picture, because she'd kill me if I said anything else, is my mom. And, my mom was very, 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 very nervous about going to the dentist. This picture was taken when we were in Massachusetts, and we moved to Miami in the mid-'60s. And my mom was always the cool mom. When we moved to Miami, she just like stopped smiling all of a sudden. And I thought maybe because I was just breaking things, it's just very precocious, causing way too much trouble for my brother and her, that she just stopped smiling. And I actually took it personally, but I eventually found out that my dad said, your mom's going through a lot of dental work. She's embarrassed with her smile and she's having a hard time going through it. And I didn't know anything about it. And he actually said that your mom is very nervous about going to the dentist and she would have to take drugs to go to the dentist. And this is back in the late 60s, early 70s. And if you were taking drugs in Miami, nobody noticed you were driving, on drugs. It was just kind of a typical thing. And, all of a sudden, when I was around 12, 13 years old, she just started smiling again. And I was like astounded, like, what a transformation. Like my mom was back. She started going to my ball games and just became the fun mom again. And I realized like, wow, this is like really cool what our dentist did. And, the Beatles had just broken up, so I couldn't be the fifth Beatle. And I just decided, maybe this is something that I could do. And it was nonstop from there. And that created my why for me initially, why I wanted to go to dental school. I wanted to help people that were fearful of going to the dentist. And little did I know that cosmetic dentistry would be coming along. And I was lucky to have Ron Goldstein as a mentor. And I just jumped right in, not just with both feet, my whole body jumped in. And shortly after I'd gotten out of dental school, her mouth started to fall apart. Actually, right around the time she was going through breast cancer treatment. Long story short, she made me make a promise that one, I would take care of my brother and my dad, but also that I would become the very best dentist I could possibly be. And that's just made me a voracious learner, just like many of you are who are on this broadcast tonight. So, I'm a big fan of self-development. And Simon Sinek is one of my absolute favorites. If you don't want to read this book, just read his or go watch his video on YouTube. And I think, what purpose do you have, when you get up in the morning? And it's not just, I got to go to job and make the donuts or whatever. It's like, what is your cause? Well, I wanted to be the very best dentist I could possibly be. And I don't know what your why is. And you may be here just to hear the jokes, or you may want to learn and get some CE. But what I really want to do is just help you get clearer about what the result is and share some ideas with you in a very short period of time, because this presentation is a small microcosm of what I spend, doing an all-day presentation. So I'm going to kind of hit you with a fire hose for the next 57 minutes or so. And, but I want to at least give you some pearls and tips along the way. So, when we were in school, there was a very methodical way about doing things. The technology has absolutely changed the landscape for us, where let's say you're doing teeth in a day. You don't have to do all the steps. You can just remove the teeth, put the implants in, and put the teeth in the same day. Still a lot of things that have to be done ahead of time. But nevertheless, I'm here to share with you maybe some tips on ways you can maybe get rid of some of the steps and be more efficient, because I think that's part of what our patients actually do want. So tonight I'm gonna share with you some key factors in doing smile design, helping your patients be real with your patients, also create dramatically beautiful smiles that are realistic. They're not fake, they're not chiclets, and you can be in charge of the destiny of that. Of course, having a great lab technician makes a difference, but nevertheless, you're the quarterback. You're the advocate for your patient's best interests. And I'm going to try to share with you some technology that helps your patients see what's possible. That could be an all-day thing right there. But I'm also going to try and share with you some ways that I use some critical steps in helping people get beautiful smiles. And also, I'm not Dr. Evil, but I've been using laser technology. It's amazing to me. It's almost 20 years that I've been doing that. And I've been able to save my patients a lot of time, a lot of discomfort during their care. So I happen to be a member of 15 years with Catapult. I get to work with a lot of these really, really amazing people. And a few disclosures before we get started is I'm a huge proponent of responsible aesthetics. When I was president-elect of the AACD, we believed in doing the right thing for people. If you need to move teeth, instead of doing instant orthodontics, let's move the teeth, preserve tooth structure. I've always believed in that, and that was something we advocated quite a bit back in those days in the AACD. And I would like to say I'm leading edge more than bleeding edge. I do test a lot of products for companies, but I also do a lot of things that have been research driven. I'll mention a lot of products tonight. These are ones that work for me. These are not the products that I always use. And I hope that we will learn a lot from each other. And at the same time, I'm going to share a lot of things with you. I'm going to make movie references. It's kind of stream of consciousness. I'll probably make some bad jokes, just like this movie from We Are the Millers, or this picture from We Are the Millers. You know what I'm saying? So I've been very blessed to travel the world and see some great places. These are pictures from New Zealand, and it was a bucket list thing. And I hope that many of you get a chance to go there. And I think about travel and what this presentation is going to be like. I'm going to be taking you on a journey tonight. All right, I've been doing cosmetic dentistry since the 1980s, when it was really in its infancy. And we've actually gone almost 40 years. And I'm going to share with you some rules of the road. I'm going to share with you a little history and maybe some insights about trends and about the future, give you maybe some perspective of things. And I want to also share with you how you can have fun creating smiles, because it can be extremely frustrating. That not every person is the same, and some people are just very easygoing, and some people are not so easygoing. And I won't use any cuss words in describing those people, but nevertheless, at the end of the day, I'm going to share some pearls with you. Actually, I'm going to share a string of pearls with you, because that'll be even more valuable for you. And I hope that I respect your time, and you feel that the time you're spending with me has been extremely well worth it. We've got almost 1,000 people on here tonight. I don't feel like Bruce Springsteen, but it's nice that we have a lot of people on this call from all over the world. So let's just move forward. So I live in Atlanta, GA. I've been here since '76. Other than the time I lived in New Orleans doing my residency. I'm a huge music fan. I have been blessed. Other than not seeing Otis Redding, I've seen everybody in this picture and more. And Georgia is always in my mind, even when I'm traveling. But Atlanta is famous for a lot of things. This is downtown Atlanta, and we're famous for traffic. If you've ever been here, you'll understand what I'm saying. And I've been blessed to have Ron Goldstein, not only as a teacher that taught me my senior year of dental school, but as a friend and a mentor along the way. And I think it's important that we all have great mentors. Jerry Sheesh moved to Augusta and after Katrina, and it was great to have his friendship. And I'm also just blessed to be surrounded by this team. I mentioned Springsteen before. I kiddingly call us Hugh Flax and the T Street Band. I cannot do what I do without these wonderful people. And they allow me to focus on a lot of things and the important things. And I'm glad to be surrounded by them. And this is the place I get to play every day. Love this office. Been here for about, oh my God, 6 years now. And it continues to get better as we go along. And this is my youngest child, Josie. And it's a picture from maybe a year ago, but it's always nice to come home and get a good smooch from her. And so here's a study from 1997. And I consider USA Today the adult weekly reader. And if anybody, I don't know if anybody remembers this study, but what would you want to change about your physical appearance? And a lot of people would say weight and so forth, but it actually happened to be the face. And they took it a step further. And what would you want to change in your face? Guess what, folks? This is a dental webinar. So your answer is teeth. And what a blessing back in late 90s, early 2000s, when Extreme Makeover took over. Bill Dorfman, God bless you, man, for bringing dentistry into the fold for that. We were able to start speaking a language to people that they didn't know before. You'd ask people what a veneer was or gum lifts or something like that. They had no clue. Everybody spoke that language, and it really was a boost to dentistry. And while we got that boost, a few things changed in our world. We had a change in our world. I can't believe I got a headline with Putin in it. Wow, things have not changed that much. But, there's a diversity in our world. And people have different expectations. Some people want that Hollywood white smile. Some people want something that's more natural. Some people want a little bit of bling in there, and there's some things I specialize. Bling is not one of the things I specialize in. But nevertheless, the world has changed and people have different expectations for things. And while we've had those changes in expectations, the aesthetics, the rules, the aesthetics really have not changed. I'll give you some ideas that maybe will help you make it simpler for you. The biology has stayed the same. But function has changed a little bit. We've always thought that there were external stresses that, you were worried about things at work or something like that, and you were clenching and grinding your teeth. You were worried about, all the politics in the world. That's why we were, second molars were breaking, crazy last 2 years because of all the stress. And, but then there's the internal stresses that we've learned about with changes in diet, medications, sleep issues. So it used to be just occlusion or maybe some muscles, but now we're dealing with things like the head and neck and the head positioning and stuff like that. So that's really changed the game when it comes to function, and especially with sleep. But people's expectations have changed in terms of they want it done faster, or they want it done less invasively, or they want it affordable, they want it durable, they want repairability. And then you got these DSOs that jump in there that have huge budgets, and they definitely can, they're trying to compete with smaller businesses. And it's certainly understandable, and we have to do everything we can to be able to compete. So with that being said, I have believed, and I'm not running for any political office, but we do have a time for change. We've got all these factors that we're dealing with, and we've had to become more customized for our patients so that how we perform dentistry has to change, and how we deliver that information had to change. And I gotta little issue here with my computer. There we go. So we've had to leverage our time more with people. We've also had to be more innovative with people and be creative as well as we've done that. And this paradigm has always been in dentistry. You got to start with function of biomechanics and periodontal, and then aesthetics is always, at one time come last. That's what I was taught in dental school. Don't make a nice temporary for somebody because they'll never come back. Well, I learned because I was becoming more aesthetically oriented when I started my practice that if you made them a bad temporary, they would definitely not come back. So we've had to kind of expand our horizons, color outside those lines, and be more creative and more innovative. Thankfully, technology's allowed us to do that. We've become more driven, cross-trained in different things, placing implants and things like that. So now we start with the aesthetics. John Coyce, Frank Spear have been teaching that for years. And I'm not reinventing the wheel, but we become more wide open about interdisciplinary care. Doing just simple things like scaling and root planing, or being able to do gum surgery or place implants. Learning how to do ortho. I mean, so many people are doing Invisalign right now. It's in such hot demand by our audience that we need to learn those skills. And then, of course, if you want to be able to do things with lab skills, people are using CEREC and other things that allow you to create bite guards and all these things. It's tremendous what we've been able to do right now. So here's our first key that we're going to hit in the next in our journey over the next 45 minutes. Is first, just like Stephen Covey said, you got to begin with the end in mind. You got to know what kind of smile you want to create. And in the South, a lot of people don't believe in Charles Darwin's theories, but one thing he said was absolutely true. Beauty is the association of many complex associations. When you look at a face and you look at a smile, you have to be looking at the eyes, the lips. And Larry Rosenthal, God bless him, he came up with a great analogy, and I love to share this with my team and with my patients, is that the smile is like a Broadway play. When those lips go up, the lips are like the curtain. All of a sudden, you're seeing teeth, which are the actors, the centrals of the stars of the show, and everything is like the supporting actors, and the gums are the scenery. Everything has to balance. If it doesn't balance, you see a little bit of asymmetry, it definitely makes people start to scratch their head and say, I'm not sure I really like that smile. So we got to evaluate people's smiles. You got to evaluate the face. As we quote unquote get older, hopefully wiser, things change in the lower face, but you ideally want to have the lower face and the mid face matching up with each other. So you want the midline. These are those road maps I'm sharing with you, is that you want us to have the midline of the teeth, ideally matching with the glabella if you can, and the size of papilla. I've had so many patients say, hey, I want you to go ahead and fix my midline. And I show them a picture similar to this. And I'll say, well, yeah, we can do that. There's been a lot of studies on this, that if the midline is within 2 millimeters laterally, you can, and it's vertical, it's going to look fine to the layman and to a professional. But I've had patients say, well, I want you to fix my midline, and it's like 3 or 4 millimeters off. I say, honestly, I think I'll have to send you to a friend of mine that will have to do surgery and all that. And people say, oh, maybe I don't need that. I would definitely make sure you address midline when you're having a consultation with your patients, so that you're managing their expectations, because that's a key thing to your success in cosmetic dentistry. So again, you're looking at the eyes. You want the pupils, the interpupillary lines matching the incisal edges there. So you see balance. It looks, unless somebody has eyes like Quasimodo, you want to see some balance. You want to see some symmetry in somebody's face. Again, I mentioned the Broadway play. When you look at the frame of the smile, you want to see proportions. You want to see beautiful lips and symmetry there. And then sometimes you see lips that just aren't symmetrical. And part of your strategic plan for your patient is to say, hey, I can make your teeth and your gums look beautiful, but we got a little problem here with the lips, and I can help you to a certain point and maybe give you like a B+ smile, but you're going to need to see a friend of mine to help that lip. And it's good to point those things out, not to shoot yourself down and shoot the patient down. It's just, again, to manage people's expectations. So I love to see the edges of the teeth, the anterior teeth, match the curvature of the lip. It just looks much more youthful when it's convex. And if I see it looking concave, I start to wonder, what's going on here? Maybe there's some orthodontic relapse, that maybe the canines are longer than the centrals, and you get that concave reverse smile there. And it makes me start to wondering, functionally, something might be going wrong under the hood. And I look at gingival symmetry a lot more than I used to. And when you have somebody who smiles and their lip goes up above those gingival margins, that becomes a very high aesthetic risk. You want those centrals to match each other. So sometimes you may have to tweak that. Laterals, I like them slightly different because I'm not trying to create a denture. And if we have edentulous spaces, a lot of times we might be able to use pink, or we may have to have some grafting done surgically as well. Axial inclination is absolutely critical because it kind of flows with the face, flows with the contours of the face, gives it that tilt, kind of like the V shape you might see in somebody who's athletically fit. And these are things you can just tweak very, very easily when you're designing a smile. Just slightly tweaking, like, let's say, the distal ear of a canine, and all of a sudden that smile, the bicuspids start to show and it looks much more attractive. Again, color is something that you could spend days on. That is not the focus on this, but you want to see some multichromaticity. I love seeing halos and sisal, translucency and texture in the teeth. So I use this book by Claude Sieber, wonderful book, and I'm not sure if it's in print anymore, but page 87, that's the key one. And this helps us communicate with our lab technicians. It also helps us communicate with our patients about what we want to create a natural smile. And the patients really appreciate that. So that microanatomy, the texture is extremely important. And then I'm huge, especially because I have the power of the laser, that I want to create that width to length ratio of 75 to 80% width to length ratio on the centrals. The laterals create that charm in there. And I'm going to address this thing about golden proportion just a little bit here as well. And I like canines to have that dominance to them. I'm not trying to create a masculine smile, but sometimes you can have something that's oval and it gives them a nice, more youthful appearance there. So, again, sometimes people get too scientific about a smile and say, well, I got to measure everything. I've learned a little bit more of a European approach to it. Is it pleasing to look at? I mean, I'll know if it's a great looking smile, and I think you just develop that eye for it, but you want to see enough teeth to show. But I'm going to show you some tips in just a second about how to really get more of a keen eye on that beyond just the rules of the road that I just shared with you. So, of course, I'm a Dolphins fan, so I got to have my obligatory Miami Dolphins picture here. And, Jerry Shee's taught me a lot of great things, and he's been a buddy of mine since, 1994, 1995. And this wonderful book that he wrote, and he was nice enough to share with me some slides I'm going to share with you. And this is a slide from that Stephen Hsu created. It's a study he did years ago. And Stephen he's not only a great dentist, he's a lab technician, and he gets to work with Dennis Tarnow. So he has a very huge perspective of things. And it's not, you're looking at virgin teeth here and an implant, and you're thinking, well, these are the sizes of the teeth, the way it should be. But what's more important is looking big picture from the, on a high point here in the clouds, is the average width in this picture let's say, is 8.5 millimeters. Look at the central or the laterals, 2 millimeters difference, and the canines are a millimeter difference. And when a orthodontist asks me, well, how much space do you want between your central and your canine? Well, I determine if my central is a virgin tooth, and I want to make that width of the lateral 2 millimeters less than that. It helps my orthodontist position the teeth, whether I've got a natural tooth there or I want to place an implant. It makes it easier for the surgeon to help, or I might even be placing the implant myself. It just keeps you in charge. You are the architect of your patient's destiny. And there are a lot of great orthodontists there, but orthodontists really appreciate that level of ownership there. So here's a key picture. If you want to take a picture of this, these are some key points to be thinking about. You want to show at least 3 millimeters of white in a smile, the width and the length, like you're showing the picture. I don't need to read this to you. Midline has got to be vertical, and you know the 2 millimeter rule and the lateral rule for the canine. If you know these 6 things, it'll help you plan your smiles out kind of geometrically in a way, but the same idea. You at least have some control in your treatment planning. So when I think of a strategic plan with a smile, I'm thinking about first place is when I look at a smile, where do I want that incisal edge? And people make such a big deal about that. And there's some rules of the road on that, like when we were doing dentures with people. That's always a great way to plan that out. But when I know where my incisal edge is, and I know that I want a tooth 10 millimeters long, again, 75 to 85% width to length ratio, you measure that. Then I know where my gingival level has to be. And then if I'm going to place an implant or have a surgeon place an implant, I know that that implant needs to be at least 3 millimeters below the gingival margin and at that gingival crest. So it gives you an idea how to treatment plan cases either for your doing your own aesthetic work with surgery or gum lifting, or if you're going to have refer that out to a surgeon. So my technique, and this is my recipe, is I try to create a mock-up for my patients on big cases. But even if I got 1 or 2 incisors that I need to play with, I'll just add some bonding to it. But sometimes I'll do a mock incise. I'll design something with Exocad and then print a model up and do a mock-up, and we'll talk about that in just a little bit. And then when the patient is happy with it, then we'll go into a full wax up, because I want that. We're not dealing with upper teeth only. We're dealing with function. So everything has to work. And then when we're in the middle of our case, we're going to do a test drive so that we know that the aesthetics are right and the function is right as well. So the second thing is, well, we got to give them what they want. Well, patients are coming to us for one reason and one reason only. When it comes to their smiles, they want to know that you really care about them. And, I like to, for a while, I communicated visually, 2-dimensionally, and the SciCan was a great product that we had. And, but it really didn't do enough. And I wanted my patients to get something more than just looking at something 2-dimensionally. It worked for a while, but you want to make them feel really, really great in this process. And thankfully, my good friend, and at one time he was doing some of my lab work, Christian Coachman, was here in Atlanta working with Team Atlanta. He came up with the idea of digital smile design. And this article was published quite a while ago. And, people are more visually focused than ever. I mean, who reads anymore? I mean, people want to look at the pictures first, then they'll read the captions. It's unfortunate, but we find that not only planning a treatment, but getting patient satisfaction is greatly improved when you're using photos along the way and creating that collaboration. That's the key, collaboration. I use that word a lot with my patients so that they understand I collaborate with them. I collaborate with my lab technicians. I collaborate with the specialists I work with, and they feel really good about that. We're looking out for their best interests. But when you look at the whole panorama of dental treatment, and Christian was nice enough to share these slides. I'm not like a comedian. I'm stealing people's jokes. I'm nice enough to acknowledge people. But you look at the panorama of dental treatment. When people come to us, they get marketed, and then we plan their treatment, and then we plan it, and then we perform it. And this is a query that we ask when I do a live lecture. We can't do that together. But the key thing in all of this is you got to present it well. If you don't present it, even with the best plan, if you can't present it and the patients aren't motivated to move forward, you don't perform it. Somebody else is doing it. People are calling for your records and stuff like that. I don't want that to happen. And do I hit it 100%? No. But nevertheless, I want to do everything I can to leverage myself with our patients. And, we want to share our passion for dentistry with our patients. So, people, like my mom, hated going to the dentist. She didn't like the pain, the discomfort, everything, the time it would take, the grinding, everything that they didn't like about that. But, people also have other priorities. They want a new car, they want to go on vacation, they want to get divorced. Dentistry is like a small microcosm of all the priorities that people have in the world. But so you got to create an emotional link. And when people have to make big decisions, you want them falling in love with what you do. So you want to get them emotionally linked to what you do. That's why I'm doing more mock-ups with people, so that they get a chance to test drive before they even buy. Then we do the technical explanation. It used to be when I see other people present treatment, it was like, oh, we'll just sit down, we'll go through a whole list of stuff. And people never really, completely bought into this whole thing. So left and right brain behavior, when you're right brain behavior, you start thinking more emotionally. So what do we do to allow our patients to be more emotionally driven? Well, the one best thing I do is I show their smiles on a big screen. If I hold a mirror up to them, they go, I don't like that. I did a class for them, and they said, I don't like that hair on my lip or something crazy like that. So we want to get them out of the analytical mode. And, I completely forgot that when I started doing DSD, you look at this display here, and I was completely analytical, and the patients were looking at me with their eyes really rolling back in their head. They go, what the heck are you talking about, Dr. Flax? So I started to learn that I got to, follow the master. And the best way to do that is I'll show you in this case, is to look at what patients have and find out what they want. And you could see this patient came to me, a buddy of mine is a bass player, said, hey, you know what? She comes in and said, I don't see my smile anymore. I look like Witchy Poo. I forget what movie Witchy Poo was, in a children's movie, but she hated the way she looked. And she said, I want to look the way I used to. And I'm not a mind reader, right? Like a cop stops you and says, do you know how fast you're going? It's like, I always say, well, I don't know. How fast was I going? I'm not going to admit to it. So she shows me her smile. It's like totally different. And she wanted to look like the way she used to. Her x-rays look fantastic. And she unfortunately had worn her teeth down. Her width to length ratio here didn't look great. So I decided I was going to go ahead and do a DST on my own. So I waxed this up, and I used composite to do it, and did a mock-up, create a mock-up matrix on that, and always scalp it so it's easier to clean up. And here is Tamara. What do you think?
It's awesome.
Yeah, look at that. Oh my God, look at all those teeth you're showing. Well, with this. How do you feel?
Awesome, except you're going to take them out.
I know, but it's a process. We'll get it all there for you. And when was the last time you were able to show your teeth when you smiled?
Too long.
Yeah,
too long.
Like forever.
Mm-hmm.
Since you had your surgeries and everything like that. So this is pretty exciting, isn't it?
Yes, it is.
Yeah, I bet you can't wait to do this.
I can't.
Okay. So what I was able to do for Tamara is give her hope. And that's the best thing you can do for anybody. And she's was a social worker, and social workers unfortunately don't get paid enough for what they do. And but I gave her hope, and she found the resources to change her life. And now she's left the social work. She's started her own business, and she is actually taken up singing as well. And her life has completely changed. Did I have something to do with it? I'd like to think I have, but she had to, implement a lot of things as well. But I was glad to be part of that transformation for her. So you look at the difference between point A and point B. It was a big change, and I started to learn that conventional is time consuming. Digital is definitely where it's at, and thankfully, Coachman and others came up with the DSD app, and Ralph George was really one of the key people behind that. And it's a wonderful app to use, and you can just see here, you can show many little tricks in showing people their smile before and after, and you can play with it. What I learned is I needed to create a room completely dedicated to doing DSD, and I'll show you why in a second, because you can do your photography in there, and you can go ahead and do your mock-up while they're sitting in the chair, and they can see their pictures on the screen. So I create a multi-purpose room, which actually is a lot of fun. It's become very, very efficient and completely different than most of the practices around me. A little tip here, if you use bayphoto.com, you can take some of your photos, some cool photos that we have, and you display them differently than just putting them in a frame or something like that. So feel free to use that. And so a patient of mine that came to me, she had sleep apnea, got a sleep appliance, and she got some huge benefits from that. But the benefit she didn't expect is that her teeth didn't touch anymore. And I said to her very simply, you really need to see an orthodontist. They can go ahead and put your teeth in the right place and get some occlusion. And so she went to see Tom Skafaitis, who unfortunately retired, fantastic orthodontist. And she said, you know what, at this point in my life, she was about 60 at that time. She says, I don't want to wear braces. And I said, okay. I showed her what it would like to do a DSD app. And she says, this is much more interesting. So I did the DSD motivational mock-up. They sent me it's cool. We sent everything to Spain, and they go ahead and create the mock-up with an STL, and then we print it, and then we create a putty matrix of that, and we do a mock-up with Luxatem. And one of the things that we do when we do our mock-ups, we take a video before and we take a video after. They see themselves side by side. Huge motivational leverage there, because when they see, here's how I am and here's how I could be right next to each other, and you do it with motion, that creates emotion for people, and they start to see, wow, I could actually be this person. So here she is in her mock-up, and it's almost like we did the treatment right there. So she was pretty excited about that. And I said, well, we need to go ahead and make this functional. So I deprogrammed her with an Equois deprogrammer, took an open bite, and the lab waxed this up. And then we did minimal prep. I wouldn't say minimal prep veneers, but it was mostly facial preps on this, kind of build volume there and build some edges, some occlusal pressure in the back. And she just ecstatic about it. And she's been very, very happy about that whole process. And, technology has been great. You get phones and, you think, okay, I'm going to get something faster. And, when did it get to the point where the question in my mind is, when is obsolescence and good enough balance each other? And it never does. I feel like I've run into a brick wall, because sometimes, especially when it comes to dental equipment, you got the cost, the ROI, and then you have to train the personnel to do it. And sometimes they know it even better than me. And then you got to train me to be able to do it. So I truly believe that the future is now. You may not know this, but what we have now is a world where we digitally are taking a lot of measurements, whether it's photography or scans and stuff like that. A lot of people are still getting into that scanning business, and then we take that, send that all to a lab or whatever you decide you're going to do, and then it goes through a digital phase. But ultimately, the output is going to be analog. And that's kind of the world, that's the world that we're dealing with. And the three things that we all got to have, and I'm a firm believer in all these things, but you got to start with a great scanner. And if you're going to have a scanner, you might as well have a printer. It's like, why buy food and not have something to cook it with and create something? And then I've just got into, because of the, I wanted to improve the efficiency of getting my cases back. So I've learned how to do some design on my own, and I'm still working on getting better at that. But, the key thing, like everything in technology or anything you do in a business, is you've got to implement that systematically, methodically, and it has to be understood. And that was a very slow process that I did with my team. Now that we don't even think twice about it, it's kind of like breathing air. It's very, very, very simple. But we've improved our technology along the way. In dentistry, we had, CEREC in 75, and it got better and better and better and better and better. And then we got some other things. And finally, I took the jump because I had a CareStream scanner, and I went to an iTero. But the advantage of all these things is you have less discomfort. Things are much more simplified. You don't have to pour models anymore. Yeah, you may have to print them, but you can send things to lab technicians, and it's easy to communicate things with our patients. And I'm again, a movie reference. I'm a Dirty Harry fan, a good man. It's got to know his limitations. And bottom line, one size does not fit all at all. So I've had a lot of different choices. Right now, I'm pretty much using my iTero, and that will probably change. But I still do PVS, a big Kettenbach fan as well. But nevertheless, it's important to be always thinking big picture. What can we do more? So, it's crazy with the iTero 5, because my hygienists start the conversation with a lot of our patients, besides photos, doing this, and it allows them to educate our patients about their mouth. And at the same time, it gets them thinking preventively. Gee, I'm seeing all these bite pressures on your teeth. And here's the reason why your teeth are chipping. And they go, oh, okay. And it starts to make sense. And it starts to make sense, like maybe we should move those teeth so we can do simulations for them and see if that fits into the model that I use. I can choose what cases I treat and what cases I refer, because I set up the artificial intelligence, stack the deck in my favor, in my patient's favor as well. And of course, we can do restorative with that, which was the original reason why I got into scanning. And then we can place, design surgical guides with implants. So it's multifaceted, and it's so funny that it's actually starting with our hygienists, which it wasn't before. Printers are key. I have some friends that have a whole warehouse of printers, and it's like a farm where people don't want to buy printers, but they want to print stuff. So they just send it to the farm, and they print their models that way, and they get it back, a day or two later. They're willing to pay for that instead of just buying a printer. Doesn't make sense to me, but nevertheless, it's a huge industry, and it's going to get bigger and bigger and bigger. So a printer is absolutely key. You can get whatever printer you like. I like the Sprint Ray. It's just been very, very simple. I think this is a company that is thinking big picture about a lot of things, and it's just continually getting better. But I'm not disparaging any other printing system. This is the one I'm using right now, because a lot of people will ask. But one thing that starts to change, and because if you have a scanner, you have a printer, you can do a lot of things. But if you want to do a lot more, you have to decide, how do you want to design things? And do you want to design it on your own, or you want to have somebody else do that for you? So if you do it on your own, you got to get the software, like you get Exicad or something like that. But if you don't want to go through the training, then Portal Design is best for you. If you want to have control of everything and self-design, then you can get a 1-hour turnaround, a lot of things. And you end up saving money because you don't have to send anything to the lab to do the initial wax up or the mock-up. So you can really leverage your time with a patient even better. I have patients come from out of town, and the next day I have a design made, where I can go ahead and do a mock-up on them. Or if they've broken teeth, I can do a wax up without mounting models, and I can have a set of temporaries ready for them the next day. It's really amazing. But there are a lot of companies that you can use through a portal. I've had some bite guards made by Sprint Ray. I've had surgical guides made by SciCat. But if you want to do some things on your own, these are a lot of people are using Blue Sky or 3Shape. I've chosen to use Exocad. One, because I had CareStream software and they had this, they had bought, I guess, a module for that. And I thought it was like really great that I could actually do digital smile design. And actually, to be quite honest with you, Christian Coachman is involved with that system, and which is fine with me. But I can do a lot of things that they were doing at DSD and create smile designs for my patient. Only problem with the CareStream one is that particular software module did not connect with my printer, and so I had to just jump ahead and get my own software. So that's where I'm at right now. Now, there are a lot of people on this call that may say, hey, I don't want to be like you, Hugh, which is fine. A lot of people say that to me, and sometimes I don't blame them. But nevertheless, I think that having the ability to create a smile and show a patient what's possible is a healthy thing. This is a software that Todd Snyder turned me on to a couple of years ago called Preview. And it's very simple. You just help our patients get that dental IQ, and you don't have to spend a whole lot of money to do it. All you got to do is take a picture, upload it to Preview. Your staff can do a smile design that looks very, very natural, maybe a little boxy, but you're creating an image that people can say, wow, I could make some big changes here. So it takes maybe 5 minutes. So here's a few examples of this. We just completing a makeover on this patient. And here's another one. We did this makeover. So it motivates people to do that. So if you want to get that software, just look up preview.com, previewdental.com. This is a great software to use if you want to just keep it really simple or have an easy place to start at. So and key theory is looking at the macro aesthetics. I'm a big believer in managing pink. Again, I use a laser, but some people don't want to do that. That's okay with me. But it's worked really well for me. And I won't go into all these things here, but I'm just going to share this case and another case with you before we finish up the evening. And I might run 5 minutes over, so I apologize. I'm going to let you know that ahead of time. But here's a patient of mine, young lady, and she's not happy with her smile. And, you look at this and you say, oh, okay, she's got small teeth. And I've never found that it's easy to understand what people are thinking. So when I look at this smile, and I thought, oh, very simply, she just wants bigger teeth. And I said, and you look at this picture, and again, I would ask this as a question if we were live. The part that bothered her the most is the black area around her teeth. When she would smile, it looked like her smile was like disappearing. And there's a reason why her smile was disappearing. Literally, you see right here, this is a telltale smile, obviously, that she was bulimic. And I just asked her, I'm looking at these pictures, just very humbly saying, could you explain to me what's going on here? Because usually there's acid or something like that. So I didn't want to insult her. And she says, yeah, I was bulimic. I'm very happily married. I've got 2 great kids. And I said, well, I appreciate your honesty. And looked at her case and said, I'd love to, help you. And she says, I just want to have a smile I used to have. So we'll look at her picture. It's like, thankfully, she sent me a picture, and it's like she didn't have the black area around her teeth. She also doesn't. That guy is not her husband either. But looking at her smile, it's like if we want to create a natural smile, again, I'm using the rules of the road that I share with you. You want the gingival margins to match the CEJ of the canines. You want a nice curvature of the incisal edges to match the lower lip. So with my software, I was able to create a much more natural tooth. I kind of just stretched it out, made a copy of it. And that got her attention. And the question is, how do you get there? There are many ways to do it. There are a lot of people that think, oh, well, you're Dr. Evil, you use a laser to do these things. You would just go ahead and circumcise the gums. Well, if I did that, that really wouldn't solve the problem, because biomechanically we may have some issues. The bonding may not work as well in the cementum. We'd have to reduce a lot of gum tissue. So, and I just seen Frank Spear do a lecture in London about worn teeth. And the smart move is to put the teeth back where they needed to be. So we went ahead and I did 6-month smiles. And I have a great orthodontist. And he treated my daughters, and he's always been a great partner for me. And he said, Hugh, if you're going to do this, you need to go ahead and true the teeth. You need to get these bent wires. And, that this is a very popular item with a lot of different companies now. And look where I had to go ahead and put the wire to straighten the wire up. And there was no room to put a bracket on there and fit it into the groove. So I had to fit at the edge of it. But we intruded those teeth about 2 millimeters we need to go 3 to get that gingival margin to match the canines. And when we got fairly close to, it's kind of like being in the red zone in football, I said, okay, we'll take this off. We'll take some measurements, sent this off to our lab. And this is the wax up that we got back from the lab. And you can see right here that we got a little gap here in our where we want to go, and we have to reduce the gums here. So this is the putty matrix that we use. Here's where and here's where these gingival zeniths need to be. So I measure that.
Ladies and gentlemen, welcome to my underground lair.
So as a laser dentist, I have to show a Dr. Evil smile here. Here are all the choices we have with lasers. And lasers, without getting into too much science, are very much like how teeth interact with light. So they could be reflected. They can also get, you can get some refraction or transmission. But with lasers, you want absorption. And it all depends on the substrate that your target area here. So when you're using a diode laser, you can do a little bit, but you got to have dark pigment or hemoglobin. That's why diodes are really good for that. If somebody at a dental meeting says, oh, I got a diode laser and it cuts on teeth, what's Britney Spears' initials? BS? Yes. So you would definitely not believe me, you just walk away or run away. But John Coyce created the standard for how to plan out. If you're going to do a gum lift on somebody and do a closed gum lift, you need to know the anatomy of that. What are you dealing with? What's the biologic zone? And he did this study years ago, and I apologize, I'm having to rifle through this. But on normal anatomy, 85 to 90% of the time, from the gingival margin to the crest of the bone, 85, 90% of the time is 3 millimeters. So if you're going to adjust the gum here and the bone is encroaching on that area, you have to adjust the bone to compensate for that. I hope that makes sense to you. So what I did, and kind of like, what they do in Extreme Makeover, they would go ahead and draw lines where they're going to do the plastic surgery. And it's a good guide for me. I still do this, and I adjust the gum tissue, prep the teeth, and then went ahead and temp the teeth after I'd taken my, gotten my gums. And then what I did is use the temporaries, 1, to make the teeth look better, 2, to act as a retainer for those, for 7 through 10. And then I did my closed gum lift, which really is you're taking a laser and you're creating it as a perio probe, and you just go, loop, just like a perio probe to that black mark, and it's up to 3 millimeters. Unfortunately, laser companies don't make that mark on there, so you're going to have to do that yourself. But nevertheless, it's a very, very simple teeth technique, and this is how our patient looks afterward. So you're looking at her smile, and it's like she's in her temps, she's ecstatic. We did this right before the holidays, and I said, go home, have a white Christmas with your teeth, enjoy your smile, and come back in a few months. Tissues look fantastic. We're able to take our impressions on her. This is how everything turned out for her. And when you look at, the money shot right here, this is really beautiful tissue. Wish we'd gotten this contour just a little bit more symmetrical with number 9, but nevertheless, fantastic result. And unfortunately for me, she moved away and I never got to finish the rest of her case because she really needed full mouth rehab. But just a great result, nevertheless. So the fourth key is to be like CSI. You've got to have a plan, and it's got to be accurate and calibrated. My team and I are very calibrated on that. And John Coyce taught me a lot of things. I thought I knew a lot about dentistry, but he uses this Rubik's Cube to help you treat and plan a case. And if you think about all the colors of the Rubik's Cube, the biomechanics could be green. And, bottom line is all these risk factors have to be taken into place. And if you can figure out how all these relate to each other and make them work together, you can figure out your Rubik's Cube. And medical management habits have become a bigger problem than ever these days. But once you figure that out, you have a very predictable way of creating these things. So my strategy with my patients, I figured out when I was at the Corvette Museum, is that you have to understand what people want with their smile. You have to co-discover at every single visit that you have with them, and you want to verify and validate that and create some vision and manage their expectations for that. So once we've done that, just like they do at the Corvette Museum, when we're in Bowling Green, they'll go create a blueprint with it, create a test drive for that, and then you get to go out with that prototype, just like our patients use their temporaries, right? And then if they're happy with it and we've done all the fine tuning, and that's when we can go with a win. That's what our labs are for, to create those final extras. So I'm going to show you this one last smile here. This is one of my youngest daughter when she's still very a cutie. But we had a generalized wear case. Patient who worked for Coca-Cola was unhappy with how her smile looked. And I asked her, I said, was this, an occupational hazard? Were you drinking a lot of Coca-Cola? And she said, no, I've been grinding my teeth my whole life. And you look at her teeth, again, even worse than one of the cases I showed you before. The width to length ratio is completely reversed. These teeth are much wider than they are long. And you look at her case. This is a case where she had dysfunctional occlusion, because you look at her case, she had all the wear in her front teeth, and they had crowns covering up the wear that she had on these other cases, or on these other teeth. So good bone level, good biomechanics, other than having the endo on this. But nevertheless, a good case to work with. So we just had to plan this out. When you're looking at this case, you want to look at, again, the midline was just a tad off. And when you're looking at her incisal edges and the width, we definitely need to, she's got a high risk aesthetic case, no buccal quarter showing. She wanted to show more smile, and passive smile here. She doesn't show her canines. So it's a clear idea with all the wear that she had. She's not showing the canines. We had to open up her bite here. So we waxed up the case after we deprogrammed her. And this is my plan with these kind of cases. I do the front 20. That works better for me. And you can see this is an additive case. And when I did the wax up, what was really cool about this is I saved the piece on number 8. I'm a hoarder, I guess. I'll admit to it. But it allowed me to have a verifying check of where I wanted my gingival margins to be, and it made it easier to plan this case out. So we went ahead and sculpted the left side first. You can see very, very clean. It's sculpting, and then we sculpt the right side, and you can see all of a sudden she's, and this was very clean with the laser, an erbium laser. And then I went ahead, and unfortunately, when you do a full mouth case and you're opening the bite, you've got to do some crowns. I would always prefer doing veneers. I do the veneers on the bottom if it's possible, or onlays. But on the top, I need to create some good occlusal stops. And Again, I use, when in a case like this, I'm still in the analog world. I use Futars or Kettenbach's bite registration material. And when I have them in the temps, I love this temper material. I've been using it for a long, long time. GC's Temp Advantage. And here she is in her temps. And here's where I'm doing my closed flap in here. And she comes in for a temp check. She's ecstatic about it. She's like a type AAA personality. She's going off on a cruise. When she comes back, she wants not only the porcelain, she wants the wax up on the molars so we can move forward. Lab did a beautiful job. I'm just amazed what the labs can do. And you can see with the putty matrix, everything stayed in exactly where the temp models were. And apologize, I'm going to skip this step here, but this is a model of how you use lithium disilicate and zirconia, different types of, you want to create some micro retention, irritation in the inside and in the intaglio of the restoration. So with lithium disilicate, you're going to use phosphoric acid and silane. With zirconia and metal, you're going to use aluminum oxide, and you've got to use MDP. And a lot of the cements, bonding materials have MDP. I take it to another step with using Biscos. And these are the cements I love to use. You can take a picture of this. I really, I kind of go between a lot of different ones. I really love the GC cements. I'll show you why in just a little bit. But with all these new cements, resins, I love the universal cements because they're easy to use. The thickness is so thin right now that you can go ahead and dry the preps with and then go ahead and cure them. And I know I get a good bite, a good bond there. I always use air abrasion because it increases the bond strength by 25%. So after I've used I'll just show you a few steps here. After I use the air abrasion, I will go ahead and treat the teeth with Conceptus just to disinfect. I say I'm going to etch the enamel. A lot of time I do etch the dent. It's a very short burst. It just kind of opens those pores up. And then I paint the resin on there, the universal bonding material on there. I use 2 coats, blow it. You got to blow that stuff off. You got to spend some time doing that. Don't, at least 10 seconds. And then I'll light cure it. And I like seeing that shiny layer on there. And then I do a lot of testing for GC along with other companies. This is a cement I think shows a lot of promise. It's not on the market yet. Just keep your eye out for it. The one thing I love about it is, one, it's easy to dispense, so you can have a lot more precision with it, and it's much easier to clean up. And then the biomimetic cements, I love. There's a lot of different ones. Right now, I'm using GSEM 1. If you haven't seen this, this is literally like a Swiss Army knife. Some very challenging situations. Somebody's crown comes off. They're from out of town. You don't have any biomechanical retention. This is like a miracle to use. Now, why do I use it on my other cases? I just get more security with it. It's extremely reliable. It's very technique and sensitive. And it's nice to have a reduced inventory. And the nice thing is, especially some patients that have some issues with, their tongue thrust and saliva and all that other stuff, the product that I'm going to show you, the AEP, at least according to the research, makes it very, very helpful when you've got to deal with saliva. So I use air abrasion, like I mentioned before, on the zirconia, put the Z prime in there. And this is what I paint on the tooth, the AEP, and just blow it off thoroughly. You do not have to light cure this at all. And then the GSEM 1, very simple dispensing system. This isn't like mixing zinc phosphate like the years before. Excuse me. And here's my patient. So a huge difference in her appearance. Profiles dramatically improved. Even with a deeper bite, Everything looked fantastic with her. Lab did a fantastic job for me. And then when I check these, yeah, I use paper, but when I want to verify and have this is our final bite, and if the bite shifts, I have a record to say, well, we got your bite exactly where it should be, and I may have to charge. But look at the difference, the before and after here. So I want to just share that it's been great spending some time with you. I apologize I went into overtime, but like I said, this is a very digested version of what I do a whole day. I think Smile Design has so many tools that you can involve your patients with. It makes it fun and collaborative. And when you can use different tools that, lasers and abrasion and bevels and bonding and all these other things, you can be minimally invasive. You just have to use your own imagination. So I hope I've given you some building blocks tonight to really create a better life for your patients. And as I started with my mom, I got to end with my dad. My dad would always say, you just got to try a lot harder. So just keep pushing forward and keep learning. So if you want to get in touch with me, you can take a picture of this. You're welcome to do it. If you send me an email, just put in the subject line, mention this seminar, and then I'll know to follow up with you. If you want to learn more, I'm involved with the GACD. I helped start it. Joyce Bassett is speaking for us on October 7th. And let me just check to see if we have any questions, and we can finish up our evening. So let me see here. So, hey, Susan, nice to see you here on this call. How does the hygienist start the process using the scanner? Well, we engage in a conversation. We take some photos, so they kind of get used to, hey, this place is different. We take a lot of pictures here, and the best way to take pictures of your patients, especially the iTero Element 5, is you can do three-dimensional scans. And while we're doing that, it's almost like taking intraoral camera pictures of the teeth. So you really educate the patients, and they start saying like, wow, this is the coolest technology I've ever used. So it's great when the hygienist can start that conversation, because when I'm walking in there, the patient's already more educated than what we've ever had before. Shanna has a great question. How are you managing the patient's bruxism? Well, there's a lot of ways to do that. That could be a long seminar, but I always like to start out with deprogramming them, see if this is a case that is within my sweet spot. If it's something that, let's say they've got a constricted occlusion, then I'm going to say, well, I really need you to get together with an orthodontist. We need to get those incisors out of the way so that the teeth come together better. And then I think that I'm getting kicked off here. So that's the last question that I can answer. As they say, you've been a great audience, and look forward to seeing you again somewhere. And remember to tip your waitress. So I will see you later. Take care now. Thank you again.